All right, so hello class. Today we're going to be doing preventing sexually transmitted infections, also known as lesson 9. So we're going to start with our video as we usually do, and then we will continue on to the next slide.
I just love how we can tell each other anything, you know?
Me too, mi amor.
Well, see you tomorrow in school.
Bye. Ugh, I still can't tell Eva about that little red sore I found between my legs in the shower the other day. It's so embarrassing, but I'm starting to worry. Should I look it up online? Maybe I should see a doctor. What am I gonna do? I've never had to talk to anyone about something this personal.
Okay, so just think about what happened in the video. Obviously, there's some communication that needs to happen there, some things that Dulce's worried about. So we're just going to think about that, and then we'll come back to it on the second part of the video. Your learning objectives for today are going to be you identifying and describing common STIs and their symptoms, describing ways that STIs can be transmitted, and identifying community resources for STI testing and treatment. Your evidence of achievement is going to be if you participate in all the lesson activities, means doing your Google Classroom activities that have been assigned to you, and if you complete all of those lesson activities, and if you are committed to protecting yourself and others from an STI. So some of you are probably wondering, well, what is an STI? You've been saying the word like 5 times now. What does that even mean? So STI stands for sexually transmitted infection. Sexually is related to having any sort of sexual contact. So any of the types of sexes that we've mentioned before, whether that's anal, oral, penetrative, vaginal sex, all those types of sex. Transmitted means passed from one person to another, and infection is an invasion or bacteria, viruses, or parasites not normally found in the body. So what STIs have you heard of? Obviously, we're not in the classroom, so you all can't shout them at me, but if you are comfortable saying them out loud, if you've heard of certain STIs, you can say them out loud, and if not, just think about a couple in your head. So these are the STIs that actually exist. We have chlamydia, gonorrhea, hepatitis B, herpes, HIV or AIDS, HPV, pubic lice, also known as CRAPS, syphilis, trichomoniasis, and Zika. So some of you are probably wondering, well, some of those, I didn't even know were STIs. Well, yeah, they all are. If you don't know what certain acronyms mean, like HIV, AIDS, HPV, that's completely fine. We're going to talk about all these STIs. So what you're going to do is you don't have a worksheet, but what you do have is a Google Classroom activity called STI activity. Using that Google form, you're going to look at that Google form as you're watching the rest of the video, and the video is going to help you answer those questions on your Google form. Okay, so I'm going to switch from this presentation to an STI slideshow that we have, and I will continue on this presentation, and this presentation is the one that's going to have the answers to that Google form. So you can go ahead and pause it, open up that Google form, and then come back. All right, so sexually transmitted infections. I will not be showing any pictures of STIs because scare tactics don't work. And what I mean when I say scare tactics is the idea of showing you a picture, making you think that it's something gross and scary, might make you more likely to use some type of barrier or abstain from sex. We don't believe in scare tactics because they have been proven not to work. So instead, we're just going to give information about what could happen to your body if you got an STI. But notice that I'm using the word STI and not STD. So we try to steer away from using sexually transmitted diseases because a disease sounds like you are going to die. And for most of these sexually transmitted infections, there is medication for it to go completely away or treatment for you to be able to still live a normal life if you have these infections. These infections, just like any other infections, just like the cold, is just someone being sick, sometimes for a short amount of time, other times for a longer period of time, but there's no reason as to why we should continue this stigma that people who get STIs are dirty or nasty, because they are very common and in fact could happen to I believe it's 1 out of 4 individuals anywhere from the ages of 15 to 25. So those are some big numbers, okay? So let's go with this with an open mind. So before we get started, there are different types of STIs. There are bacterial STIs, parasitic STIs, and viral STIs. Bacterial STIs, what's important to know about those is that they are treatable. So you can get medication for these STIs. You will take your medication, and within a couple of weeks, this STI is gone. Now, although there is medication for it, it doesn't mean that if you get it one time, that's it, you're never going to get it again. They are treatable, but they are also repeatable. So you can get chlamydia multiple times in your life, you can get gonorrhea multiple times in your life, and you can get syphilis multiple times in your life. It's not just I got it one time and I'm fine. If you do not take care of yourselves, if you do not use the proper barrier methods or have conversations with your partner and get tested regularly, you can get these STIs more than one time. The parasitic STIs are also treatable and also repeatable. So they're treatable, there's medication for that as well, and they will go away. Those are pubic lice and trichomoniasis. The viral STIs and any STIs that end with a V, so HIV, HPV, herpes simplex virus, hepatitis B, Zika, all of the viruses, if it's a virus, that means that there's no cure for it, okay? So a virus does not have any cure. But some of these viruses do actually have treatment. So although there is treatment, that doesn't mean that it's going to go away. That just means that it kind of takes care of the symptoms and helps your body still live a normal lifespan. But you will have the virus in your body forever. Okay, so just know that. All right, so we're going to start with chlamydia and gonorrhea, which are bacterial. If you can see, there's a little green dot right up here. So bacterial STIs are going to have the green dot, parasitic are going to have a yellow, and the viral STIs are going to have a red dot. So chlamydia and gonorrhea. The reason that we pair these two together is because they're known as the sister STIs. And we call them that because they manifest in the same way and they have the same symptoms. The only difference is it's a different type of bacteria that manifests. So just like we all have different names, different bacteria has different names, and that's why they have different names, chlamydia or gonorrhea, okay? The reason that they're grouped together is because it also often happens that sometimes when one person gets one of these, they then after get the other because their body is just more susceptible for the bacteria to grow in those specific areas where they had unprotected sex, okay? For the transmission of this, it is going to be through any unprotected anal, vaginal, and oral sex with a partner who has one of these STIs. Also, it can be from mother to child if the mother is pregnant and is not aware that they have chlamydia or gonorrhea, and then they give birth, and the child could potentially also get chlamydia and gonorrhea. The symptoms for these STIs and all the other STIs I'm going to mention, the most important symptom is that there's no symptom at all. So what happens with all of these STIs is that for the first 2 months, usually, most people have no idea that they have the STI because there are no visual symptoms and people don't feel anything. Okay, so you can go about 2 months without knowing that you have this STI, and if you're not getting regularly tested, you unknowingly are transmitting that STI to other people that you have unprotected sex with. So that's why we stress the importance of getting tested regularly and also using a barrier method so that you're not the person that accidentally gave your partner an STI, okay? If you do have symptoms or when people do have symptoms, for chlamydia and gonorrhea, they'll usually be the same. For people with a vagina, it will be an unusual vaginal discharge. And notice how I say unusual because a vagina has a natural discharge that is constantly being discharged from the vaginal opening. What that is that's the vagina kind of cleansing itself. So it's like a clear liquid that flows out of the vagina. Not like a giant like flow like water, but there's just a natural discharge that occurs. So if you ever notice that discharge is unusual or not looking like the normal discharge that comes out of the vaginal opening, then that's when you should be concerned. It doesn't necessarily mean that you automatically have chlamydia or gonorrhea because there could be other reasons as to why the vaginal discharge is different, but it's just good to know what the regular vaginal discharge looks like and what an abnormal vaginal discharge looks like so you can stay in tune with your body and know when you should visit a physician or a doctor to get that checked out. Unusual vaginal discharge could be yellow, white, clumpy, really, really, really strong odor, and it can be kind of uncomfortable. Okay. Any abdominal pain, frequent or painful urination, or having the urge to have to urinate. For people with a penis, any kind of discharge is not normal. Unless you are ejaculating, nothing else should be being ejaculated from the penis. It is not seminal fluid or pre-ejaculatory fluid. Okay, so any kind of discharge from the tip of a penis, if it's white discharge, kind of looking like pus, then you should go get that checked out, as well as abdominal pain or symptoms and frequent or painful urination. Long-term effects. If you do not go get tested and say you don't show any symptoms for a really long time, throughout that time that you are not having symptoms on the outside, you are still damaging your body internally. So if you leave that untreated and you don't get the right medication, long-term effects of chlamydia and gonorrhea can lead to sterility, meaning that you cannot bear or have children. Pelvic inflammatory disease, also known as PID, which is when the pelvic kind of sticks to the walls of your body, and it's very uncomfortable and painful. And it also leaves you at risk of contracting other STIs because your body openings are very susceptible to just contracting other STIs. Testing and treatment. So for chlamydia and gonorrhea, you can get tested through a urine sample, a vaginal swab, and if you had unprotected oral sex, then you have to get a separate throat swab for oral sex. So chlamydia and gonorrhea can both manifest in your throat, and that is not detectable through a urine sample. So when you go to your doctor and they ask you, have you had unprotected sex? Oftentimes when they say the word sex, they just mean all types of sex in general, and they're not specific. Physicians should be more specific so that you're aware to answer this question. But I'm aware that not all physicians do that. So instead, I will show you all how you can advocate for yourself and how you can get the proper information. With that being said, you want to tell your doctor, I had unprotected oral sex. Can I have a throat swab to check for any STIs that can manifest there? Once you say that, then the doctor can give you a throat swab and check for any chlamydia or gonorrhea that has been localized in your throat. Okay, like I mentioned before, this is curable. So if you get antibiotics, you can get cured for chlamydia and gonorrhea. Syphilis. So it's another bacterial STI. It is transmitted through unprotected anal, vaginal, and oral sex, and also mother to child, just like the other STIs. The symptoms, like every other STI, and I'm going to say this over and over again, the most common symptom is no symptom at all. But for syphilis, what the symptoms look like is in the first stage, you get painless chancre sores on the genitals or the mouth. And notice that I say painless, so that makes it even difficult for people to acknowledge that they're there, because since they're painless, no one knows that they have those sores on their genitals unless they actually look at their genitals to see. The second stage of syphilis, if left untreated, is you will start to get rashes on the palms of your hands and the bottom of your feet. Okay? And then the third stage, if left untreated after the first and second stage, it can lead to organ damage. Okay? So that can be damage to your liver usually, also brain damage. So the long-term effects, if you let syphilis go all the way to its third stage, it can lead to blindness, organ damage, brain damage, and paralysis. Now, although this is an STI that is curable, say you were unaware that you had syphilis and you're already at the second stage, or say you're at the third stage and your liver has been slightly damaged, but then they realize you have syphilis and they give you the antibiotics. So the syphilis will go away, but any damage that has been done to your body is not reversible. So if the syphilis has already damaged your liver, then you have a damaged liver and that has to be taken care of some other way. The syphilis will be out of your body, but any damage done to your body or organs will not be reversible. Okay, I just want to make sure we are aware of that. Testing for syphilis, it's going to be a blood test. If you have an open sore, it could be a swab, but that would be that you have to be aware that you have an open sore. And it is curable with antibiotics, as I mentioned before. Moving forward, we have pubic lice, also known as crabs. So pubic lice are one of those STIs that, regardless of you using a condom, you can get this through genital to genital contact. So notice how for the past two, the transmission was unprotected. So for the other three, if you use a barrier method, you can prevent yourself from getting those STIs. For pubic lice or crabs, it's a little bit more difficult because it's just any genital to genital contact, regardless of using a condom or not. A condom or a barrier protects certain parts of the skin, but not completely. So if somebody does have pubic lice and their genitals touch your genitals, it's most likely that you're going to get pubic lice too. Okay? Aside from genital-genital contact, it's going to be unprotected anal, vaginal, and/or oral sex. The common symptoms, again, no symptom at all, because most of those STIs are asymptomatic for about 2 months, meaning there's no symptoms for about 2 months. But when you do get symptoms, there'll be an itching or an irritation on your genital area, visible bite marks, or little lice eggs, okay? Long-term effects, if you don't go get it treated, then from scratching so much, you can cause a skin infection on your genital area, okay? For testing and treatment, you will be able to visually tell if you have pubic lice, just like regular lice, or you can ask your doctor to check if you are unsure, but you have all the symptoms that you just can't see that you actually have lice. What the treatment's gonna look like, it can be an over-the-counter lice shampoo, gel, or foam. You don't need a prescription. You can get it on your own, and you want to apply it to the area so that it kills off the lice and the lice eggs itself, and then you're all good to go. A lot of people think that they can shave the area and that's another form of treatment, but it is not. In fact, and I'll tell you why. If you look at your arm, you have these tiny little hairs that are growing out of your arm, and every single place on your body where these hairs grow, they are attached to these pores. When you shave the genital area to supposedly get rid of pubic lice, the lice burrow themselves into those pores. And then the moment the hair starts growing back out, the lice will come right back out with the hair itself. So that is why shaving does not work. Please just go get the medicated shampoo that you need, and that way you can actually make sure that you kill off the lice and the lice eggs themselves and you get rid of them completely. Next, we have trichomoniasis, which is also a parasite. It can be transmitted through unprotected anal, vaginal, and oral sex. It easily infects the vulva, vagina, penis, and urethra. Okay. Symptoms could be vaginitis. Vaginitis is very similar to trich, in which it would be kind of a itchy, red, burning sensation in your vaginal area. There could also be blood and vaginal discharge, itching and irritation, swelling, or pain during sex. That's all what vaginitis is, as well as what would be one of the symptoms for trichomoniasis. Again, the most common symptom, no symptom at all. The long-term effects is it can cause pelvic inflammatory disease. So we talked about what that was, PID. The walls of the uterus are very sticky and can get stuck or attached to the walls of the body where the uterus is, and it can be quite uncomfortable and painful for people. It can lead to infertility if you don't go get it treated. And if you are pregnant at the time you get trichomoniasis, your baby can be born early or at a low birth weight. It also increases your chance of getting HIV just because your body is more susceptible to getting an STI. The testing and treatment, it's going to be a swab of the penis or the vaginal opening. It could also be a urine test, and yes, it can be treated with antibiotics. Hepatitis B, our first viral STI. So this one has a red dot. This is a viral STI. Transmission of hepatitis B can be through unprotected anal, vaginal, and/or oral sex, through blood sharing, or through blood in general, but that could be by sharing needles, so through drugs, piercings, or tattoos. Make sure if you go get a piercing or tattoo that it is at a certified location and that they are opening a clean new needle in front of you before they use it. Symptoms would be flu-like symptoms, loss of appetite, nausea and vomiting, hives, or also very common, not having any symptoms at all. The long-term effects could be a serious damage to the liver, pelvic inflammatory disease, and also infertility. Usually, hepatitis B can go away on its own. Luckily, there's a preventative vaccine for it. Most of you got it when you were very, very young. And if you have chronic Hep B, there are medications. So you can get medications to help with your liver. Most of the times, hepatitis B will take care of its own and go away. Herpes. So This is my favorite one to talk about because everyone is so cringe and like afraid of herpes, yet statistically, about 80% of the world has one of the herpes simplex virus types, and about 90% of people in the US have herpes simplex virus type 1, which is oral herpes. Most people don't know it, and if you're sitting there thinking that, no, that can't be me, it probably is you, okay? And I'll explain why in a little bit. So, there's two types of herpes. There's herpes simplex type 1, which is oral herpes, and then there is herpes simplex type 2, which is genital herpes. Both virus types can be transmitted through unprotected anal, vaginal, and oral sex, and also direct skin to skin contact with infected areas. So if somebody has an outbreak and you touch that part of their skin to skin contact, you can get that virus type. Okay. That is the reason why 90% of people in the US have it, because it's so easily transmittable. Nothing to worry about. It's not life threatening. Like I said, some of you probably carry the virus and have no idea because you've never had an outbreak, and that's fine. If you go and get tested for it, you can if you'd like to know if you carry the virus, but most physicians won't even test for it because there's no cure for it and it's not life threatening. Okay? The symptoms would most commonly be no symptoms. Like I said, people can go their whole lives not knowing that they have the herpes simplex virus type 1. Herpes simplex virus type 2 is a little bit more noticeable because that would be sores on your genital areas. But for people who have sores on their mouth for oral herpes, that one's a little bit more difficult for people to be aware that they have that. What's going to happen is you're going to have sores on your mouth or on the genital areas, as I just mentioned. So HSV1 is oral herpes, HSV2 is genital herpes. Long-term effects, not life-threatening. You'll have an outbreak every now and then. Sometimes, some people never have outbreaks. When you do have an outbreak, you can take medication for it to ease the pain or to shorten the outbreak and so. Testing and treatment, like I said, physicians don't usually test for it because there's nothing that they can do about it other than give you pain medication, and that's the only treatment that you can get. The only thing the physician suggests is that if you are aware that you have the herpes simplex virus, whether that's oral herpes or genital herpes, that you do not engage in any kind of skin to skin contact or unprotected or just in general skin to skin contact with your partner during that time, because when you are going through an outbreak, it is when the virus is most present at the surface of your skin. So right before somebody has an outbreak, where they're going to have an outbreak, whether it is on their mouth or near the genital area, they'll get a sort of tingling sensation. And then a couple days later, they'll have a visible sore. That sore is filled with kind of little tiny pockets of the virus kind of seeping out of it a little bit, kind of like a cut. And if people were to kiss someone while they have the oral herpes, or if someone was to have sex, which would be penetrative, oral, any type of sex with somebody during that time, it is very likely that they can transmit that virus type to their partners. Okay, so just don't engage in any sexual activity while you have an outbreak, and that way you don't spread it to your partner. Okay, now herpes, people call them cold sores sometimes or fever blisters. So those are any sores on your mouth or on the edges of your mouth. Anything inside the mouth is not herpes. If you ever get little open sores inside your mouth, those are called chancre sores, and those are usually caused by stress, heat exhaustion, changes of appetite, changes in exercise or physical activity. Those are more like mouth ulcers and happen just randomly to people, okay? Herpes is anything on the mouth or on the edges of the mouth, not inside the mouth. HPV, also known as the human papillomavirus. So HPV is another one of those STIs that can be transmitted through genital contact only. So skin to skin contact only. So regardless of using a condom, if you come in contact with somebody who has HPV, you can get HPV. Now, when I say this, I don't say it so that you can be like, well, then what's the point of a condom? Because condom and barrier methods still prevent against a lot of the other STIs that I've mentioned before. But I just want you to be aware and that you're having these conversations with your partner so that you're aware of your status, whether you all have gotten tested, and just the kind of step that you're taking towards with that partner, knowing that, say, they might have HPV or knowing that they might have herpes, okay? Symptoms will include no symptoms usually. Sometimes people might get genital warts, but what happens, so let me backtrack a little bit. So with a human papillomavirus, there's over 200 different types of this virus. About 12 to 14 of them can lead to long-term effects, which would be cervical cancer, penile cancer, or anal cancer. But most of the other strains, so the other 190 something or 180 something virus types, usually will only cause genital warts or won't cause anything in your body. So because this STI is so common and because there are so many different types of this virus, statistically, if you are ever sexually active in your lifetime, you will contract one of these virus types, okay? Now, it's nothing to be completely afraid about. What's good about knowing that there's about 12 to 14 of them that can lead to cancer is that there's a vaccine for you to be able to prevent from getting those 12 to 14 strains that can lead to cervical cancer. So on the last slide, on the last slide, but on the last little square at the end, it says vaccine prevents you from getting 12 to 14 strains. There's a vaccine called Gardasil. I don't know if it has a different name now. It usually, or it used to only be administered to young girls ages 12 to 14 in a set of 3 shots. Regardless of you being sexually active or not, it was just a preventative vaccine that you got when you were younger to prevent you from getting the strains when you got older. But now they have recently started administering it to all genders at the same ages, so ages 12 to 14. So anybody could get that vaccine, ages 12 to 14. Again, it's not assuming that you're being sexually active at that age. It's just a preventative measure for when and if you decide to be sexually active at a different age, okay? Long-term effects of HPV, if it's a cancer strain, it can lead to cancer. If it's another strain, your body will kind of take care of it and it'll go away. For testing and treatment, to get tested for HPV, it would be a pap smear in which they widen the vaginal canal and then they take a little swab and kind of scrape the edges of the vaginal walls to check to see if you have abnormal cell growth, which could be the HPV virus or which could be HPV. If it's cancer, then they will offer you cancer treatment, and then any kind of treatment after that would just be you getting the vaccine to prevent getting the other strains, okay? Next, we have HIV/AIDS. So HIV stands for Human Immunodeficiency Virus. We have other lessons dedicated strictly to HIV, so I will not dive too much into the information about it, but just give you a little bit of information. Transmission of HIV can be through any unprotected anal and vaginal sex. There's a lower risk of you getting HIV through unprotected oral sex, but although it's a lower risk for HIV, there's still a higher risk of you getting other STIs through unprotected oral sex. You could also get HIV through sharing needles and from mother to baby, okay? The symptoms would be either no symptoms for all the other STIs that I mentioned as well, just like I said before, no symptoms. But if you do have symptoms, they might start off as flu-like symptoms and then progress from there. If left untreated, it can cause AIDS, which is acquired immunodeficiency syndrome. And what HIV does is it damages your immune system. So your immune system, for those of you who don't know, is what is in charge of keeping you healthy. It's what fight off other bacteria, the viruses, and how you kind of maintain yourself and stay healthy and you're able to live. HIV damages your immune system to the point where your immune system cannot properly function and can lead to death if left untreated. Before leading to death, you most likely can get acquired immunodeficiency syndrome, just meaning that your immune system is very compromised and at that point doesn't serve its function. Testing and treatment to get tested for HIV would be an oral quick swab. So they can swab the side of your cheek to test the antibodies in your saliva. And if your white blood cells are very, very, very low, then that means your immune system has been compromised. Your white blood cells make up your immune system. So if your white blood cells are very low, then that means there's something wrong with your immune system. You can also get a blood test. It could be either they take a little tube of blood out, or there's also a finger prick that's now more advanced and they can take a blood test that way. if you do have HIV, there's treatment called antiretroviral treatment. What it does is it helps your white blood cells get back to a normal count, and that way your immune system can still function properly. So it's amazing because now we're in a time where getting HIV treatment or HIV treatment is now at a point where if you start taking it in the early stages, then you are most likely to still be able to live a normal life. Okay. There's also PEP and PrEP. So, say you have a partner who does not have HIV and you do not want to give them HIV, there's medication that your partner can take while you two, say, decide to have a child, you're having unprotected sex. That person can take PEP or PrEP and it could avoid them from getting HIV. Okay. PEP stands for post exposure prophylaxis, and PrEP stands for pre exposure prophylaxis. I know you might have questions about that, but we have lessons coming up strictly dedicated to HIV so they can answer all of those questions. One last thing to be very aware of is the only fluids that can transmit HIV, because there's still a lot of misconceptions, meaning that a lot of people are not aware of the fluids that actually transmit HIV. But the only ones that do transmit HIV are blood, semen, rectal fluids, vaginal fluids, and breast milk. Okay? A lot of the times we get students tell us, oh, what about saliva? No, saliva does not transmit HIV. You can kiss someone with HIV and you will not get HIV. Okay? All right. And I believe this is our last one. We have Zika. So, Zika is always the one that people are very confused about, but it is a virus and it can be transmitted through unprotected oral, anal, or vaginal sex. It could also be transmitted through mosquito bites. Most common symptom would be no symptoms, but when you do have symptoms, it would be fever, rash, headache, red eyes, joint, or muscle pains. The effects that it can have on your body is if you're pregnant, it can cause a miscarriage or stillbirth. It can also cause microcephaly in a child, which is when a baby is born with a very small head and brain. Testing would be blood or urine tests, and then the treatment would just be to get plenty of rest and drink a lot of fluids until the virus has passed through your body. Okay, so that's the end of that slideshow. If you have any questions about that, feel free to ask in the anonymous question box. All right. And then I hope all that information has helped you fill out your Google Forms activity. So we're going to resume back to the other slides. All right, so when and where should you get tested? So we talked a lot about the different STIs that you can have, how it is that they occur, but when and where can you get tested? So you can get tested when you have had sexual contact with another person. You want to wait at least for an accurate test, 2 weeks for an accurate chlamydia gonorrhea test. You can wait 2 weeks after you've had sex with your partner to get an accurate test. For an accurate HIV and syphilis test, you would want to wait at least 3 months, or at least 3 months you would want to wait before you can get a accurate test, okay? If you were planning to have sexual contact, so say you and your partner are planning to be sexually active, but you're like, oh, wait, I haven't been tested before. I haven't been tested since my last partner. Go and get tested together, make a date out of it. Be like, hey, you want to go get some ice cream and also go get tested? Yeah, I would like to do that. Like that'd be awesome, cool, It shows a lot of maturity, and if you're okay having these conversations with your partner, then that means that maybe you two are ready to take that next step, okay? It shouldn't be something awkward. You all are only talking about your health and you want to keep each other safe, so that shouldn't be an issue or something that's weird. It's not weird, and if you think it's weird, you should be second guessing whether you are actually ready to take that step with your partner or not. You have symptoms. Say all of a sudden you're like, "Ooh, I'm feeling a little itchy down there," and that doesn't feel like what normally it's supposed to feel like. So maybe I just want to go get checked. It doesn't mean necessarily that you have an STI, but maybe you have a different type of infection or something that you need some kind of medication for, and you still go get it checked out anyways. And if it's not an STI, cool, then you don't have to worry about that. But if it is, then cool also, because then you can get the medication that you need to get better. If you have been exposed, if somebody texts you or tells you, I know we had sex a month ago and the condom broke. I just want to let you know that I've been recently tested and it turns out that I have gonorrhea. So I think you should just go get tested just to be sure. So if somebody tells you that, then you should probably go get tested just because you've probably been exposed. If you're pregnant, so as I mentioned, some of these STIs can be transmitted through or during a pregnancy to your child. So if you're pregnant, go and get tested so that you're aware of what's happening to your body so that you can take care of it before you actually go into labor. Okay. Lastly, one thing I wanted to mention, you can find a testing site on the right-hand side here at gettested.cdc.gov, or you can call 1-800-CDC-INFO, or you can text your zip code to know it at 566-948, and it can give you a site where you can get tested. So what are symptoms of STIs? We talked about them, but for all genders, it could be sores, bumps, blisters near the sex organs or mouth, burning or pain when urinating, swelling or redness in the throat, swelling of lymph nodes near genitals or swelling of the genitals, or needing to urinate often. For people with vaginas, it could be a vaginal discharge or odor, deep pain in the pelvis or vagina, burning or itching in the vagina, bleeding from the vagina other than the regular menstrual flow. And for people with penises, it could be a drip or drainage from the penis, a burning sensation or itching in the genital area, and swelling of one or both testicles. But the most common symptom is no symptom at all, as I mentioned in every single slide that we went through for all the different types of STIs. So, an STI warning, get an STI checkup. If you have more than one partner, then you should get tested every 6 months. If you have one partner consistently, then you should get tested every year. You should also get tested, if possible, after every partner that you have sex with, regardless if it's protected or unprotected, just so that you're aware of your status constantly. Okay. And there's nothing wrong getting an STI checkup. It shouldn't be that you're going to get an STI checkup when you already think you have an STI. It should just be that it's just a regular thing you do, like when you go get your physical, just get an STI checkup just to know. Even if you think you're completely fine, then that's fine, but just get it just to know and you have those results. So when someone asks you, have you been tested in the last 6 months? You could be like, yeah, I have. And actually everything is completely clear. And then both of you have a better peace of mind and are more calm and relaxed when you decide to be sexually active. If infected, go get your treatment. Do not let it just continue on without getting your treatment. You want to get that medication so that you can get better. And you also want to get that medication to make sure that you do not continue transmitting that STI to anybody else. If you are infected, it is important to always notify your sex partners, okay? I know it can be embarrassing, but it's better for you to let them know than them not have any idea and then find out months later and there's already been internal damage to their like genital areas or the reproductive areas. So if you're aware that you're infected, please notify your past sex partners, okay? There shouldn't be any shame in it. You're letting them know. It's not anybody's fault. Just let them know. Be sure to protect yourself from further infection. So if you ever do get an STI, I hope that's just once enough time for you to learn. So make sure you always use protection after that, whether they're barrier methods. Make sure you always have this conversation with your partner about using condoms or any kind of barriers, or going to get tested together before deciding to be sexually active. So what STIs are preventable? We talked about a couple of them. Hepatitis B and HPV can be prevented with a vaccine, as I mentioned. HPV vaccines are recommended for 11, 12 years old people, regardless of gender. And all STIs are preventable by not engaging in sexual contact, so abstinence. How can you avoid getting an STI? You can abstain or postpone sex. You can reduce the number of sexual contact you have. Use condoms. Ask a person about previous STIs, as I mentioned before. Vaccinate against hepatitis B and HPV. And you can use PrEP or ART to lower the risk of HIV infection. All right, so we're going to watch the second part of the video, and that's going to conclude the lesson for today. And I will play once it decides to load. Obviously, if you're watching this on YouTube, you can probably just skip until it actually decides to load. There you go.
Is something bothering you, Dulce? You've been quiet since we left school.
What? No. Well, yes. I just don't think I can talk about it. It's private and embarrassing.
Remember, you can tell me anything, babe.
Okay. Well, I found a small red sore on my vagina, and I'm not sure what to do about it.
Oh, okay. Well, remember how we learned that most STIs don't have symptoms? I know it must be scary, but that's not necessarily an STI. But
Yeah, I know. But I should ask the school nurse or go for a free and confidential STI test at the community clinic if I'm worried about it.
exactly, and hey, I'll go with you and get tested too. This could be something from one of our previous relationships, or it could be harmless, like an allergic reaction. Who knows? We can take care of it together.
Thank you, mi amor.
Okay, so how did the story end? What happened in the second half of the story? And what can you learn from this? Again, this will be on your Google Classroom as a message board post. Go ahead and answer the questions there. All right, so this concludes this lesson. If you have any questions, please submit them to the anonymous portion of your reflection, and don't forget to fill out your quiz. Enjoy the rest of your day.